Watson can do so much more than win Jeopardy these days. What specifically can Watson Health do that, for example, a United Health or a Mayo Clinic can't do?
Well, I think one of the key things, Emily, is that we spent the last year really working on the knowledge side of medicine with Watson, understanding all the unstructured tech, the research material. And now what we're doing with the new Watson Health Cloud is bringing together all the structured information, the data that comes from the devices that we carry around, the consumer devices, the medical devices. As we start to pull that data together, the amount of information that we as humans are going to collect through our lifetime is reaching to the point where it's equivalent to 1,100 terabytes of data, or about 300 million books about each and every one of us. This is an enormous amount of information and requires really serious horsepower to be able to deal with, and Watson's going to provide that. We're going to deal not just with the knowledge of medicine, the knowledge of research, we're also going to deal with the big data around all of our individual health, bringing those together in a new cloud environment.
So give me some examples. What could Watson Health conceivably do for me as a patient?
Well, for example, if you're using your Apple device, all right, you might be collecting your information about your health in HealthKit. You'll have the option to share that information in HealthKit with your doctor so they can actually keep track of the information about you, about your care. So, for example, you have your blood pressure checked on an infrequent basis by your doctor, but what if it was being checked all the time and you were a patient that was taking medications for blood pressure? That would be a real-time system now with real-world evidence to help your doctor provide better care for you.
What about privacy? How do you protect individual privacy?
That privacy is a great point. One of the key things about the Watson Health Cloud is we have the ability to anonymize the information in a secure way. It's a secure HIPAA-compliant environment that will enable us to store that information in a safe way that makes it available for researchers. In addition to being able to share your information from your devices with your doctor, you'll have the choice to share it via ResearchKit for researchers around the world. And I think today's new generation really likes this idea of sharing for the greater good, and being able to share your health information with researchers is a way to do that as long as it's anonymized, and that's really what this is all about.
Now, the gathering of this information takes time. These big data initiatives take time. How long till we see actionable results from something like this?
Well, one of the important things about yesterday's announcement was the acquisitions of Exploris and Vitel. Between the two of them, we have data access to over 90 million lives, so we're starting off from a pretty big place already.
How do you monetize this? Who are Watson's customers of the future?
Well, as you look at the Watson Health Cloud, we're really targeting this idea of patient-centered health, being able to reach out via Vitel's applications to start to reach out and involve people more in their own health care. Bringing in the partnerships with Medtronic, we can start to monitor the data on insulin pumps, or with Johnson and Johnson, we can start to provide coaching that enables people to get ready for operations such as hip and knee replacements, and then manage them through or coach them through the therapy required to rehabilitate after the surgery. So it's a great way for us to take the value of the data, monetize it out through applications to the end users, but the same data can be used by researchers that are using the anonymized data in the cloud to look for patterns in the data to develop new drugs and new therapies. Right? All of this information is available back to your provider should you choose to make that available. So we really start to bring together the whole continuum of care from end to end, from patient to the doctors, to the researchers, and to the payers and the insurance companies.
And in terms of your partnership with Apple, you know, we're talking about HealthKit, ResearchKit. What's been the reception from Apple customers to these products? How many people are using them? How are they using them?
Well, when you think about HealthKit, HealthKit's reasonably new. It came out last year, and we're still in the early days of connecting it up to the applications. I think Apple's done a very good job of managing the privacy of that information on the devices, and then making sure that it's the choice of the consumer as to whether they want to share that information or not. I think ResearchKit is a brand new initiative that just started earlier this year, and that's going to really, I think, appeal to a lot of the millennial generation who believes that life is more than just themselves. It's about contributing to the greater good, making them part of the environment for a future health care.
So would you say not many people are using them just yet?
No, I think many people are using them yet. I have colleagues that are running around checking their vital signs on their Apple HealthKit now. What we're really starting to do is connect that data back to the health system, and that's really the next big step here.